Good afternoon, Facebook friends and family. We are here today to talk a little bit about our outpatient services, and we have our wonderful therapist, Greg Yeasley, and he's going to give us some information about how our outpatient services work. You may recognize Greg because he's been kind enough to do our other videos that we've been posting on Wednesday and then our little snippets on Monday. So welcome, Greg. Thank you so much.
Thank you for inviting me.
It's been a lot of fun working with you, and we really appreciate it. So tell us a little bit about outpatient services.
Well, outpatient is a little bit different from inpatient in that inpatient is meant to be pretty brief. People stay anywhere from 3 days to sometimes 2 weeks. Hopefully it's a quick treatment to get somebody back to stabilization, where in intensive outpatient it's a step down from inpatient. It lasts a little longer, from anywhere from 2 weeks to up to 8 weeks. So that kind of treatment is meant to be really specific. Our treatment plans are geared towards teaching people a lot about coping mechanisms, coping skills, and dealing with specific individualized issues that they have. So whether it's depression or bipolar, or if it's schizophrenia, we deal with severe mental illness and work towards getting people back to their outpatient service providers. So that's our goal in treatment. So we are a stepping stone into their outpatient services.
That's great. So does somebody have to be inpatient here in order to take advantage of our outpatient services?
They do not have to be. They can come from a referral from their individual therapist or individual providers, psychiatrists, even physicians out in the community can refer people to our intensive outpatient program. We do treat both mental health issues and what we call dual diagnosed issues, where people may be suffering from substance abuse issues. We don't do specifically substance abuse issues alone. If that's somebody's primary diagnosis, then they're referred elsewhere. But other than that, we are dealing with dual diagnosed or straight mental health IOP services.
Okay. And so are these individual therapy sessions? Are they groups?
Yeah, we deal primarily with group treatment. It's our focus of treatment, and so we don't actually do specifically individual therapy unless somebody's in crises at the moment. We do deal with that, right then and there if there is a crisis, but other than that, it's primarily group focused, and we do have available a psychiatrist on staff, and we have a nursing that's available throughout the day when people are in groups. The service amount that people are supposed to come to the IOP is a minimum of 9 groups per week. So they'll do 3 groups each day that they attend. So we're doing 3 hours of treatment in that pretty brief, intense time. So hence the name intensive outpatient.
So the groups, you said 3 hours of groups. Is that solid? Is that broken up into?
It's pretty solid. It's hour-long groups. They do have a break in between each of the groups so that there's a snack time, the time that they can work on issues with each other as group members. So we do all of that. We do primarily a process group in the morning, the very first group, where we are looking at specific issues that the patient is bringing in from their family or their friends or their home life, or social engagement, or if their mental health issues warrant it, we're looking at that. And then we're checking after that to buoy up their coping skills, and so the next group is focused on that, teaching skills about how to deal with things, and then we do some psychoeducation, some learning and activities, different things like that. It's all mixed up, so it could be things. We do some music interventions through therapy, and then we do teaching coping skills, things like how to deal with anxiety and lessen your anxiety, how to deal with depression or bipolar disorder. If somebody has a severe mental health issue like schizophrenia, we do a lot of education about that and how to deal with that on a way to be able to help them get ready to move into that outpatient service.
Okay. So with everything that's going on in our with the pandemic and everything that's going on, are we still doing groups, or what does that look like?
Yeah, groups in the morning, we call each patient and we ask them if they're exhibiting any symptoms, just as if you were to go to an urgent care, you're talking to a nurse that is assessing whether or not the patient is symptom-free, even though they may be carriers. We don't know all that stuff, but we do know that if they aren't having fevers or coughs, things like that, that they do come into the groups. At the door, we check them again for temperature and make sure that nobody's having a temperature or fever. They even do that to us as staff, so everybody's being checked on that to stay healthy. And at that point, we do have what we call practicing social distancing, so everybody sits far enough away from each other. If they feel safer or freer wearing a mask, they're allowed to have masks. They're available. If they even want to wear gloves, we got gloves. So we make somebody feel as comfortable as they are feeling, and so if they ask for those needs, we meet those needs.
Okay, that's great. So just taking a little extra precaution.
Yeah.
That's great. So do we offer transportation? So
we do offer transportation if somebody can't make it here. Even people who have cars, sometimes if they want to use our transportation, they do that. And so it's just a convenience that we call through the transportation provider that we use. They'll get a phone call in the morning, and then that arrangement will be made between the driver and them, and they'll be picking them up and bringing them here, and then we're pretty much done. The groups go from 9:30 in the morning to about 12:30, 12:40, something like that, and by the time you're ready to leave, people just take off in either their own cars, or they take off in a car that was provided for them. Yeah.
Okay. So if somebody wanted to, they know they needed help, maybe they're getting regular therapy, but it's once a month or once every 2 weeks, and they felt that they needed a little bit more care, and they wanted to come in at least to see what our program was like, would you recommend that they make an appointment?
Yeah, most of our assessments are done by appointment, so you can call our clinic at the number provided, and basically you'll be assessed both by a clinician and then by a nurse and then by a physician. So that is what we call medical necessity has to be met, so that the person has an actual diagnosis that qualifies for the service level, and that they meet the admission criteria that we have. And then once somebody is determined to do that, then they are opened and admitted. But that can be something that you do even while you're still seeing an outpatient therapist. You can still up the service level with us, and since we're hospital based, and you're not actually technically admitted into the hospital at the IOP level, you can still have an outpatient service provider where you're doing the one-on-one therapy, but at the same time still getting that enhanced support from a group to be able to learn more and to be able to thrive better. So
that's great. The last question I have is, are we open on the weekends in outpatient?
Yeah, unfortunately we're not. We are open pretty much 3 days a week, and that's kind of been evolving with the issues of the pandemic. Sometimes we're pretty democratic in our groups, so we ask them what works best for them, and so the group can sometimes determine whether Monday, Wednesday, Friday is better, Monday, Tuesday, Friday. Whatever those days are. At the current time, we are meeting on Monday, Tuesday, Wednesday, so it's pretty quick. You get those 3 days, and then you get the 4-day weekend, in which you could use Thursday and Friday to schedule appointments with outpatient service providers or psychiatrists. So we work alongside them. So
that's great. Well, thank you so much, Greg, for answering our questions and letting our viewers know a little bit more about our outpatient services. If any of you have questions, please go ahead and comment, and we'll make sure we get those questions to Greg and we get an answer for you as quickly as we can. Thank you so much, and stay at home and stay safe.